A blood infection spreading through Wisconsin contributed to 17 deaths there. And now it's being linked to a death right here in West Michigan. The Centers for Disease Control is investigating, and 24 Hour News 8's Coco McAvoy spoke with the CDC official about what they've learned so far. Coco?
Good evening. The CDC says they have seen cases of Elizabeth Kingia in the past, but this most recent outbreak is puzzling for many reasons. They now see cases reported weekly, but right now they don't know what is causing it.
It's a bloodstream illness that was found in the 1950s and has caused few infections until now.
It is usually found in the environment, mainly in soils or water, and for the most part doesn't cause infection in healthy people.
Chris Braden from the CDC says the outbreak in Wisconsin that started in November is the largest ever recorded. 17 people have died in Wisconsin, and a resident in West Michigan recently died after also getting infected. But what's the source of the illness? The short answer is that's not clear because the cases are so spread out.
And there's no one facility or no one water supply or no one environmental place or factor that we have been able to identify that could be the source of the infection.
But the common denominator for the majority of the cases so far is that the bacteria is infecting individuals over the age of 65 with serious underlying health conditions, which is why they aren't able to say for sure if it's the bacteria that caused their deaths.
It may be a factor in a lot of these deaths, but in some people it's hard to say because they're otherwise ill.
Now the CDC is focusing on products such as medicines or personal care items that the people might have used, and they're hoping to soon nail down a source for the outbreak.
It is, and nobody's more frustrated than the investigating team as to not being able to find that source. So we will keep the public informed as much as we can with the results of our investigation.
Health officials aren't releasing where the West Michigan resident lived at this time. However, they say there are a number of symptoms to look for, like high fever, nausea, getting confused, losing your appetite, or having chills or shakes.